Documentation. This identifies the health services that have been provided. Examples are hospitalization and patient or client procedures. Electronic health records allow client information to be shared by authorized users only across the healthcare system. This creates streamlined approach to the client's healthcare, and the clients can track their own health using the electronic health records. Electronic documentation used as communication in healthcare setting has advantages that include real-time access to all records by all the members of the interdisciplinary team. It has been built-in clinical alerts that contribute to the decrease and prevention of errors and duplicate testing. It has an increased coordination of healthcare services and healthcare. It eliminates illegal records. The client portals allow interaction with the healthcare providers. Downtime for documentation can happen during specific events, making electronic health records unavailable. This downtime may either be planned or unexpected, but it can always be disruptive to care. Source-oriented documentation is a traditional format for documenting within the medical record for all disciplines in healthcare. It is divided into specific sections. For example, history and physical, progress notes, nurses' notes, laboratory reports, diagnostic testing. The progress notes are written in a narrative format and created separately by members of the interdisciplinary team. Problem-oriented medical records are comprehensive and organized in the approach to recording and reading client data. Problem-oriented medical record contains 4 components: the database, where the assessment data are documented, a problem list in chronological order, the initial plan, goals, expected outcomes, further data needed if required. The progress notes use a SOAP format. The SOAP format is subjective data, objective data, assessment, and plan. Subjective contains information from the client. Includes feelings or views. It can be collected from the client or the healthcare proxy. The objective data are clinical impressions recorded in the database on what the nurse observes or measures. Examples would be vital signs and physical assessment findings. The assessment is an analysis of the combined subjective and objective data. The plan is interventions the nurse plans to implement. The PI model focuses on problems, interventions, and evaluations. Focus charting relates to specific healthcare problem. It focuses on the nursing diagnosis, changes in condition, events, and concerns. There are 3 items in the documented data. 3 items are documented: the data, the action, and the response. The focus charting includes immediate actions and future nursing actions. Charting by exception is documenting unexpected or unusual client findings based on standardized protocols. Consistency is an element of high-quality documentation. The FACT acronym provides a guide for accurate documentation that includes consistency and complete documentation. Verbal prescriptions or verbal orders by the healthcare providers who have authority to prescribe treatments and medications may be received in person or in telephone. These are regulated by the state rules for the Ohio Board of Nursing and the American Medical Association regarding the process for verbal prescriptions. When a nurse is taking a verbal order, it needs to be written in the client's record as it has been received so it can be read back to the prescriber. The only time the order or prescription does not need to be written immediately is during an emergency or in a sterile environment. The HIPAA privacy rule created regulations that govern electronic health records, and it is intended to protect the privacy of clients' healthcare information. Nurses are bound by the HIPAA law. We have a legal obligation to protect clients' personal health information. The health information of the client is not to be shared with anyone that does not have direct involvement in the client's care. Nurses who breach these regulations can be punished by termination from the facility, large fines, or imprisonment. The Health Information Technology for Economic and Clinical Health, or HITECH Act, encouraged all facilities to install computerized provider order entry systems, or CPOE. These computerized systems allow the providers to write and transmit prescriptions electronically. CPOE systems can eliminate errors caused by illegible handwriting, inconsistent abbreviations, and lack of knowledge. Thereby, the HITECH Act is to increase the client safety.